Good evening, everybody. I'm Lisa Stone from Stella Maris, and I'm going to speak this evening about hospice. So, what is hospice? So, when a family elects hospice or a patient elects hospice, the goal is that you're going from a curative type of care to a palliative care. You're going to stop chemo, you're going to stop radiation, you're going to stop things that are really going to prolong your life. You're going from a treatment mode to a palliative mode. And so, what is the goal in hospice? The goal in hospice is to provide quality, compassionate care. And we really are all about living until your life ends. We want to allow a natural death, and we do not want to hasten your death at end of life. So, lots of times families say to us, how do I know if I'm ready for hospice? Well, lots of times you and your physician or your family are all having a conversation, or should at least be having a conversation as you're going through this process. But if you do make the decision to elect hospice, be aware that 2 doctors have to certify you that if the disease takes its normal course, that the individual will have less than 6 months to live. So it's very important to understand that as a physician, 2 physicians that are stating that you have less than 6 months to live. That does not mean that you cannot be in hospice longer than 6 months. There are many individuals that do exceed 6 months in hospice. We just have to continue to have physicians that certify that you are continuing on that path to end of life with a life-limiting illness. So what is unique about hospice? What I find actually beautiful about hospice is that it really is a holistic program. We are certainly looking after the patient, but we are also looking after you, the family as a whole. What happens to you during the process? What happens afterwards? And how do we help you and walk you through the journey at end of life? Sometimes when a family member is admitted into hospice, that patient is really not able to talk, or they're not as conscious, and so really sometimes more of our work is with the family than really the patient at times, depending on when they elect the hospice benefit. Under hospice, with part of this holistic care, it's a whole group of individuals that provide the care. Medical director, social worker, nurses, nurse practitioner, volunteers, pastoral care, physical therapist, occupational therapist. Some folks don't realize that in hospice, some people still have PT and OT. It really depends on that individual need for that the care that is required. Also, grief counseling. After a person passes away, and sometimes during the process, we bring in our grief counselors. But up to a year after the individual has passed away, we offer to any family member grief and loss counseling at no charge under the Medicare benefit for hospice. In hospice, we have a rule that's called the 80-20 rule, that 80% of all hospice has to be provided at home. And so that's a big, sometimes challenge for families. And so part of our support is how do we help you along that way? We help you with our aids, with medical equipment, all provided under the hospice benefit to ensure that you can provide the best care possible. And only when you decide, you know what, I need a little bit more help, do we talk about changing from a home setting to an inpatient setting. So what is home? Home is your home, home is the resident's home, home could be long-term care, home could be assisted living, home could be a group home. We pretty much can provide hospice care anywhere. So how is hospice covered? 83% of all hospice care is provided to individuals aged 65 years of age or older. So consequently, Medicare is our primary payer source in hospice care. But there are managed Medicare programs that cover hospice, Medicaid covers hospice, commercial insurance, because obviously we are providing care to individuals younger than 65. And also charitable care. One of the comments that we hear, well, I don't have insurance or I'm uninsured, I can't afford hospice. Every hospice always has a charitable benefit. And in fact, at Stella Maris, we routinely reach out to individuals who are uninsured or underinsured to provide that service for hospice care. And we have our fund that's called the Monsignor Linus Fund that has been around for more than 30 years. And we routinely reach out to our families. We have covered apartment rents, we've paid for cremations, we have paid for utility bills, We actually are just paying for a lifeline for a patient who is at home alone and she doesn't have family, so how do we keep her at home? So every hospice has to have a charitable fund to help you provide care. The other interesting thing is people think when they enroll in hospice that they can't change their mind. You can absolutely change your mind. We have seen where folks that are younger folks or folks that may have had a stroke have gone into hospice, and all of a sudden we're noticing, you know what, I think they're getting stronger. Right now, because the doctor's looking at a time period, at a certain time period, saying, I think what I see right now, what's happened in the last couple of months, that person may be hospice eligible. But sometimes it takes a person longer to bounce back. And if that's the case, we're going to walk you through that next step in care, which could be rehab, or it could be, out of hospice and into a different type of setting. So don't feel that once you've neglected hospice that you cannot remove yourself from hospice. And if you decide that you want to return to hospice, that's fine too. We're going to go through that same certification process that I discussed earlier. So spirituality at end of life is probably so important. We see a lot of folks, and our goal in hospice is a good death. So it means a lot. A good death means many different things to many different individuals. But at end of life, people are questioning, what I did. They review their life choices. Have I done things, could I have done things differently? We hear a lot of coulda, shoulda, woulda, or we get an attack of the if-onlys. And we really help the family and the patient with our pastoral care department to really walk through those coulda, shoulda, wouldas, or, I didn't say I love you enough, or maybe I did something that I shouldn't have done. Always remember that when a person is dying, that their hearing is the last to go. So we always encourage our families and our staff to talk to the patients and tell them what you're thinking or what you're saying, and don't think that they don't hear you. We had a patient who was younger. Him and his wife was dying, and she was in her early 40s, and they had 2 children. And it was a struggle for us, and it was a struggle for our staff as well. And their 2 kids were the light of their lives. And they always put their kids first. They had their children later in life, and then it was difficult for them to have children. She was kind of close to the end, and the dad wanted to go home. And so he came to us and said, I don't know what to do. So our staff said, you know what, whisper in her ear, tell her what you're going to do, and let her make that decision. And he whispered in her ear, he said, you know what, I'm going to go home and take care of the children, and I'm going to come back. And 2 minutes later, she passed away. And we really felt that she wanted him to go take care of the children and not to worry about her, and that she would be okay. And so those are the things that I think are important to remember. The hearing is so important, and I love you, I forgive you, I will miss you, but it's okay to go. Give that person permission to let go. The other interesting thing I think we also talk about are myths in hospice. And one of the myths that we always hear is that hospice will starve a patient to death and stop all their medications. And that really is not true. We really are all about living in hospice. And we do not arbitrarily stop a feeding tube. We don't arbitrarily stop meals. What we do is that we listen to the patient's body. At some point in time, your body is going to tell us that that body cannot accept a tube feeding or food anymore because it's now detrimental. And when I think about it, if I refer back to the Comfort and Consolation, the Q&A book, and you look at pages 4 and 5 that talk about nutrition, it really does mirror the Catholic teaching in what we want to do in hospice. It's very individual. We have had folks with tube feedings for a long time in hospice, or have eaten up to the very last moment, and we've had folks that haven't because their bodies have not been able to tolerate the meal. So again, remember, we're all about living very individual and taking care of a patient. The other myth that I always like to talk about is that hospice manages pain using narcotics. Yes, we do. But we are not here to hasten death. We actually are here to eliminate suffering. And yes, sometimes along in that process, you're going to have a patient that is slowly going to be not as conscious. But that's also all part of the dying process, and we don't ever want anybody to suffer. And so we are very, all medications are ordered by physicians, and it's very well regulated. So it's not a matter of, oh, they're in hospice, we're going to give you a whole bunch of narcotics. No, we would never ever do that. We're all about eliminating suffering appropriately. So the aftercare in hospice is, so how do I go on living after someone dies? We see it a lot. You are married for a long time, you lose a child, you lose a spouse, you literally lose the right-hand side of your body. It's different. Good, bad, or whatever, it's just different, and how do I go on? And so I think that's the beauty of the bereavement services that are available in hospice. So we always encourage our family members to take advantage of it. It really has helped people to come out of grief and learn to live again, and we really do believe in it. So in closing, I always like to say this little poem. Grief is not a disorder, a disease or a sign of weakness. It is I can't say it. It is a physical and spiritual necessity, the price you pay for love. The only cure for grief is to grieve. Thank you.